Assalamu alaikum. I Dr. Muhammad Akram, Department of Eastern Medicine, Government College, University, फैसलाबाद. आज हम पढ़ेंगे स्टडी डिज़ाइन इन एपिडेमियोलॉजिक रिसर्च. टाइप्स ऑफ प्राइमरी स्टडीज. Descriptive studies describe occurrence of outcome. Analytic studies describe association between exposure and outcome. Basic question in analytic epidemiology are exposure and disease ethics. Exposure E, disease D. Basic question in analytical epidemiology look to link exposure and disease. What is the exposure? Who are the exposed? What are the potential health effects? What approach will you take to study the relationship between exposure and effects? Basic research studies, designs and their application to epidemiology. Descriptive. डिस्क्रिप्टिव में केस रिपोर्ट, केस सीरीज, डिस्क्रिप्टिव एपिडेमियोलॉजी आती है. एनालिटिक में आरसीटी, क्वाड स्टडी, केस कंट्रोल स्टडी, केस क्रॉस ओवर स्टडी, क्रॉस सेक्शनल स्टडीज, बिफोर आफ्टर स्टडीज, इकोलॉजिकल स्टडीज. टाइम फ्रेम ऑफ स्टडीज. prospective studies looks forward, looks to the futures, examines futures events, follows a conditions, concern or disease into the future. Time frame of studies. Retrospective study to look back, looks back in time to study events that has already occurred. Study designs sequence. Hypothesis formations. Case report, case series, descriptive epidemiology. Lab study, animal study, clinical trials, analytical epidemiology and clinical trials. Hypothesis testing, quad, case control or cross-sectional. Increasing knowledge of disease or exposure. Descriptive study, case control studies, quad studies and clinical trial. Develop a hypothesis, investigate its relationship to outcome, define its meaning with exposure and test link experimentally. Meaning descriptive studies develop hypothesis, case control study investigate its relationship to outcome, quad study define its meaning with exposure, clinical study test link experimentally. Descriptive study. Case reports. Detailed presentation of a single case or handful of cases. Generally report a new or unique finding, previous undescribed diseases, unexpected link between diseases, unexpected new therapeutic effect, adverse effects. Case series. Experience of a group of patients with a similar diagnosis, assess prevalent disease. Cases may be identified from a single or multiple sources. Generally report on new or unique conditions, may be only realistic design for rare disorders. Case series advantage. Useful for hypothesis generations, informative for very rare disease with few established risk factors, characterizes average for disorders. Disadvantage. Cannot study cause and effect relationship, cannot assess disease frequency. Case report. One case of unusual finding. Case series. Multiple cases of findings. Descriptive epidemiology study. Population based cases with denominator. Analytical studies. Study designs. Analytical epidemiology. Experimental studies. Randomized control clinical trials, community trials, observation studies, group data, ecologic, individual data, cross-sectional, quad, case control, and case crossover. Experimental studies, treatment, and exposure occur in a controlled environment. Planned research designs, clinical trials are the most well-known experimental designs. Clinical trials use randomly assigned data. Community trials are non-random data. Observational studies, non-experimental, observational because there is no individual interventions. Treatment and exposure occur in a non-controlled environment. Individuals can be observed prospectively, retrospectively, or currently. Cross-sectional studies and observation designs that surveys exposure and disease status at a single point in time. Cross sections of the population study only exist at this point in time. Cross sectional study populations, no disease and disease. No disease factor present, factor absent. Disease factor present, factor absent. Study only exists at this point in time. Cross sectional studies often used to study conditions that are relatively frequent with long duration of expression, non-fatal chronic conditions. If it measures prevalence, non-incidence of disease. Examples, community surveys not suitable for studying rare or highly fatal disease or a disease with short duration of expression. Cross-sectional studies disadvantage, weakest observational designs. It measures prevalence, non-incidence of disease, prevalent cases or survivors. The temporal sequence of exposure and effect may be difficult or impossible to determine. Usually don't know when disease occurred, rare events a problem, quickly emerging diseases a problem. Epidemiological studies designs, case control studies, and observation designs comparing outcomes, exposure in disease cases versus healthy controls from same populations. Exposure data controlled collected retrospective, most feasible designs where disease outcomes are rare. Case control studies, cases, diseases, controls, no disease. Case control diseases, factor present, factor absent. Case diseases. Factor present, factor absent, control, not diseases, and study populations. Case control study strengthens less expensive and time consuming, efficient for studying rare diseases, limitations. Inappropriate when disease outcome for a specific exposure is not known at start of study. Exposure measurements taken after disease occurrence. Disease status can influence selection of subjects. Hypothesis testing. Case crossover studies. Study of triggers within an individual case and control component, but information of both components will come from the same individual. Case component hazards period, which is the time period right before the disease or event onset. Control components, control period, which is a specified time interval other than the hazard period. Epidemiological study designs, quad studies, and observational designs comparing individuals with the known risk factors or exposure with others without the risk factors or exposure. Looking for a difference in the risk incidence of a disease over time. Best observational designs, data usually collected prospectively, some retrospective. Control studies. Control quad designs study population free of disease. Factor present, factor absence. Disease, no disease, disease and no disease. Present, futures. Time frame of studies. Prospective studies looks forward, looks to the future, examines futures, events, follows the conditions, concerns or disease in the future. Prospective cohort studies measures exposures and confounder variables, baselines, exposures and outcomes, non-exposures and outcome. Time frame of studies: retrospective study to looks back in time to study events that have already occurred. Retrospective cohort studies measures exposure and confounder variables, exposures, outcome, non-exposures, outcome. Cohort studies: exposure status determined before disease detection. Subjects selected before disease detections can study several outcomes for each exposure. Limitation: expensive and time consuming, inefficient for rare disease or diseases with long latency, lost to a follow up. Experimental studies: investigator can control the exposures akin to a laboratory experiment, except living populations of the subjects, generally involves random assignment to groups. Clinical trials are the most well-known experimental designs, the ultimate step in testing causal hypothesis. Experimental designs. In an experimental designs, we are interested in the consequence of some treatment on some outcome. The individual in the study who actually receive the treatment of interest are called the treatment groups. The subject in the study who receive no treatment or different treatments are called the comparison group. Epidemiological study designs: randomized clinical trials. It designs with subjects randomly assigned to treatment and comparison groups. Provides most convincing evidence of relationship between exposure and effect. Not possible to use RCT to test effects of exposure that are expected to be harmful for ethical reasons. Randomization study populations, interventions and control, outcome, not outcome, outcome and not outcome, baselines, features. Epidemiological studies designs: randomized controlled trials. The gold standard of research designs provides most convincing evidence of relationship between exposure and effect. Trial of hormone replacement therapy in menopausal women found no protections for heart disease, contradicting findings of prior observation studies. Randomized clinical trials: disadvantage: very expensive, non appropriate to answer certain types of questions. It may be unethical, for examples, to assign person to certain treatment or comparison group. Review questions developed by the supercourse team. Describe the link between exposure and disease. Describe study design sequence. Describe strength and weakness of each designs. Thank you very much. Allah Hafiz.